Hello, my name is Jasmine Salem, and today I will be administering an IM injection into my patient, Ms. Tran. Today we have our materials all here already, and I'm going to start off with that we have a 1 milliliter syringe and a safety needle that is 23 gauge and 1.5 inches, as well as a blunt tip needle to draw the medication out of the vial, which we have right here, which is lorazepam at 2 milligrams per milliliter. I also have some alcohol pads, my gloves, and today I have already checked from the MAR when receiving the medication that it is the right medication for the right patient, which is Ms. Tran, and that it will that the route will be intramuscularly at the right time and for the right reason, being her agitation. Okay, so we'll get started here, and I will introduce myself to Ms. Tran and let her know the logistics of what we're doing today, and then I will be administering the medication. So, hello, Ms. Tran. How are you today? All right, good. I have an injection for you prescribed for your agitation. So, can you help me confirm your name and date of birth, please, before we get started? All right, thank you so much. And when I get my glove on here, I will be checking her name band to further confirm. All right, thank you so much. All right, Ms. Tran, so I'm gonna have your bed up a little bit for this. So today we will be doing an IM injection, and before I explain the side effects, I will provide us with some privacy. So some of the side effects for your medication today will be that you may feel a little bit of drowsiness, you may feel a little sleepy, but that's not anything to worry about. That's normal for lorazepam. Excuse me, I'm gonna have you sitting up for this too, all right? All right, so quickly here before we get started administering the medication, I will be assessing the site. So ideally we want the injection site to be 3 fingers below her acromion process, which would be right here below my 3rd finger, with her acromion process being right here. All right, so now that we have that, all right, Ms. Tran, I'm about to drop your medication and then we'll get started, okay? All right, so I will be doffing my gloves and donning new ones after hand hygiene.
I didn't ask her if I said it outside. That bubble we do not want it to come out.
All right, so first,
You want to do it again?
I will
Can you do it again?
be prepping the top of the vial before opening my materials, just so that it has time to dry, disinfecting. And while we're here, I will do my second check, confirming that I do have the right medication, and that it will be administered at the right time, which is 1 time for the right patient, in the right dose, which will translate into 0.5 milliliters, because this vial says that it has lorazepam of 2 milligrams per milliliter. So I'm going to open up my materials here. My 1 milliliter syringe, and then my blunt tip needle. All right. All right, making sure it's on snug. Now I'll be using the double OK method to uncap. All right, now I will draw out the medication. Flick it a little so that air bubble comes up. All right, so I will be pulling out more than I need at first, just to alleviate some of the air bubbles. This one doesn't want to come out. All right, awesome, there we go. All right, perfect. So now I will use the scoop method to recap. And now we have half of a milliliter. And let me flick it a couple more times just so I can. All right, perfect. All right, so I'll be putting this down and opening my safety needle. And I will carefully twist off the blunt tip needle. Oh my goodness. There we are. All right. And usually in a normal situation, I would immediately put this into the sharps container. But for the sake of the video, I do not have one in here with me right now. So I'll be placing it right here and off to the side, but still where I can see it. All right. And now I'll be twisting on the safety needle. All right, make sure that's snug. Okay. All right, and before we do this, I will bring the table closer so that everything I have can continue to be in my sight. I'll place down the needle right here and reassess the site while cleaning it with an alcohol swab. So by reassessing the site, I will do the 3-finger method again and make sure that I still have the right area. And by doing that, I can clean the site from inwards out using a circular motion. And then we will wait for it to dry. And now I will do my third check while we're waiting and confirm that I do have the right medication and that it is going to be administered to the right patient at the right time, the right route for the right reason, being her agitation. So we're going to pull the safety cap back and carefully double OK method uncap. All right, so I will squeeze her arm a little bit to isolate the muscle. And then I will be injecting the needle at a 90-degree angle with a speed of 10 seconds per milliliter. So for this, it would be a 5-second injection. All right, Ms. Tran, I'm about to administer your medication. You'll feel a little pinch, but it'll only take about 5 seconds. All right, 3, 2, 1. All right, thank you so much. Cap on immediately, and then into the sharps container. All right, Ms. Tran, so you will feel some of the side effects to the lorazepam shortly, and it, like I said earlier, it may make you feel a little sleepy, drowsy, nauseous, but that's totally fine, and you might fall asleep for a nap, but that's totally normal again. If you need to get up for any reason or you need to use the bathroom, please call me. The call button will be right there and I would be happy to assist you. All right, is there anything else that I can get for you today? All right, thank you so much. I will be coming back to check up on you shortly to make sure that the medication has worked properly. All right, now I would be back here documenting that I administered the medication at the right time and date at the right site, and that I did my 3 checks of medication before administration. I will also document that I did my patient teaching for Ms. Tran and that she was fully aware of the effects of the medication. And then I would later come back and check on how she's doing and see and document and evaluate if the medication worked as it should have.